In conversion disorder, one or more symptoms or deficits of voluntary motor or sensory function suggest a medical condition. This always precedes conflicts or stressors. It's not intentionally produced and causes significant distress or impairment in social, occupational, or other important areas of functioning. Psychoanalysts explain that conversion disorder is caused by repression of unconscious interpsychic conflict and conversion of anxiety into a physical symptom. There is conflict between an instinctual impulse, for instance aggression or sexuality, and the prohibitions against its expression. The symptoms allow partial expression of the forbidden wish or urge, but disguise it, so that patients can avoid consciously confronting their unacceptable impulses. Conversion disorder can also be viewed in the context of learning theory. Conversion symptoms can be seen as a piece of classically conditioned learned behaviors. The symptoms of illness learned in childhood are called forth as a means of coping with an otherwise impossible situation. Biologically, it's thought that the cause of conversion disorder is from hypometabolism of the dominant hemisphere and hypermetabolism of the non-dominant hemisphere, and this is implicated in impaired hemispheric communication. Symptoms are thought to be due to excessive cortical arousal set off by negative feedback loops between the cerebral cortex and brainstem reticular formation. Sensory symptoms seen in this disorder include anesthesia and paresthesia to extremities. Deafness, blindness, and tunnel vision may also be seen. Motor symptoms include abnormal movements, gait disturbance, weakness, paralysis, gross rhythmic tremors, coriform movements, tics, and jerks. Symptoms often worsen when attention is called to them. Other associated features include the following. Primary gain is used by keeping internal conflicts outside awareness. For instance, the individual may feel guilty about being unable to perform a task and convert this into the expression, "I would, but I have a condition." Primary gain is related to internal motivations. In secondary gain, patients accrue tangible advantages and benefits as a result of getting sick. This allows them to get excused from obligations and difficult life situations. Secondary gain is externally motivated. In labella indifference, the individual appears unconcerned about serious symptoms. These are all things that you may see in conversion disorder.